Hi, John Libinati here with glutenfreeworks.com. This video is going to talk about comorbidities. I will explain what comorbidities are, tell you why your doctor might be missing them, and also show you how you can identify your own comorbidities and treat them using the Gluten Free Works treatment guide. Now let's get started. Before we talk about using the Gluten Free Works treatment guide, we have to first learn what comorbidities are. And to do that, let's go to Google. A comorbidity, according to the dictionary, is the simultaneous presence of two or more diseases or medical conditions in a patient. It's also defined as a disease or medical condition that is simultaneously present with another or others in patients. I'm making this video in the year 2020. This is the year of the pandemic, the COVID-19 pandemic, and we hear about comorbidities all the time because, as we've found, people who have comorbidities are more likely to suffer dire consequences from COVID-19. So it's important that we know what these comorbidities are. And basically, it's having two or more diseases at the same time. So if you have COVID, but you also have diabetes, those are your comorbidities. If you have COVID, but you also have, say, heart disease, that is a comorbidity. Let's look at some comorbidities a little bit closer. To do that, we'll go back to the Gluten Free Works treatment guide, and we will look under the health conditions. And here we have the health condition index. Now, all of these conditions can be considered comorbidities. So if you have, for example, chronic anxiety, a comorbidity can be physiological or psychological. It can be chronic anxiety. You can have iron deficiency anemia. You can have, here's autism. You can have eye problems. You can have bone problems. So there are many things that can be comorbidities. And basically, it's having two or more diseases. So if you have a disease and then all of a sudden you get COVID-19, well, then you have your comorbidity there. Now, why would doctors miss or potentially miss comorbidities? If it was never presented to the doctor, so if you never brought it up in when you were seeing your doctor, so unless you present your symptoms saying you have IBS, well, if you're taking over-the-counter medications and then you never tell your doctor, hey, I have diarrhea every 3 days, or I have chronic constipation, I never go to the bathroom, or when I go, it's messed up. The doctor's not going to know to ask you, unless the doctor, when he does your physical, and looks in your eyes and your ears and your mouth, sees an obvious problem, the doctor's not going to know. So it can be missed that way. It can also be missed just in that the doctor might not realize that you have something. Doctors are people, and they can miss things. And depending on what the doctor's seen in the past, or depending on how you present your symptoms, the doctor may miss it. So those two ways are how comorbidities can be missed. So you want to take the bull by the horns, so to speak, and you want to take action and identify and correct any comorbidities that you have. And it's very easy. It's not that hard. The first thing we would do in using the Gluten Free Works treatment guide is go again to the health condition search or the symptom search. Or you can just type in whichever symptoms you're looking for. And once you find, let's look at chronic anxiety, okay? We'll click on chronic anxiety, and this takes you to the chronic anxiety treatment module, all right? And the treatment module explains anxiety in this case, tells you what causes it, explains how it's related to celiac disease, shows you the relationship between various nutrient deficiencies, tells you how prevalent it is, and then also shows you the symptoms of anxiety. In this way, you can see all these different potential comorbidities, all right? It shows you how it develops, and then we give you the 6 steps to reduce or improve chronic anxiety. Okay, so it tells you what to eat, what not to eat, how to reduce inflammation, what to look for in your medications that may be exacerbating the problem, the remedies that you need to take. Okay? So that's how that works. But if you're looking for comorbidities, one way of doing it is to identify nutrient deficiencies, because hundreds of comorbidities or disease states are actually caused by malabsorption and malnutrition. You might be functioning, but you might not be functioning at 100%. Instead, you're functioning at 65%. You might not even realize it because we get used to feeling a certain way. So let's look at these nutrient deficiencies that you see in chronic anxiety, and we'll just pick one. Let's pick iron. So I'll click on iron, and that takes us to the iron deficiency module. Again, just like the symptoms, the deficiencies tell you all about it, how it's caused, the prevalence, and then all the symptoms. Now here's where you can find your comorbidities. If you discover that, all right, I have chronic anxiety, it can be caused by an iron deficiency. When you go to the iron deficiency module and you see, wait a second, I have blurry vision, my attention span's terrible, I can't remember anything anymore. Well, in this way, you can find several comorbidities that you might not even have realized existed and discovered at the same time how to fix it. Because if they're all caused by an iron deficiency, once you fix the iron deficiency, whatever's triggering it, whatever reason you're either not getting the iron or you're not absorbing it, then you fix all of these comorbidities. You can bring this to your doctor's attention, and then your doctor can treat you, or you can supplement. So this is how we find comorbidities and we treat them using the Gluten Free Works treatment guide. I hope this video has been helpful. My name is John Libinati with glutenfreeworks.com.